everyone. We are the Special Projects Committee from Asian Pharmacists Association. We will be covering Medicare and Medicaid today. Now I'm going to introduce the presenters of this talk. We are all pharmacy students from the University of Illinois at Chicago College of Pharmacy. My name is Eileen.
My name is Jared.
My name is Anne.
My name is Anna.
My name is Cherry.
My name is Jeshin.
My name is Justin.
My name is Melody.
For the objectives of this presentation, we will first go through a brief overview of Medicare, then we will cover the topic of Medicaid afterwards. So what is Medicare? Medicare is a federal U.S. insurance program that began in 1966 under the Social Security Administration. It's administered by the Centers for Medicare and Medicaid Services, and is for those who are 65 years old and older, those with disabilities who are younger, and those with end-stage renal disease. Medicare can help pay for hospital stays, doctor visits, and prescriptions. For 2021, this year, beneficiaries can have virtual check-ins through telehealth with doctors, nurse practitioners, physical therapists, occupational therapists, and other healthcare providers. Medicare can also pay for COVID-19 testing and vaccines, and here's a picture of what a Medicare card looks like.
To be eligible for Medicare, you must meet one of the following: seniors who are over the age of 65 and currently holds U.S. residency or U.S. citizen status, or seniors who currently hold legal permanent resident, which is sometimes called a green card, for at least 5 consecutive years. People with disabilities under 65 who has previously worked for 40 quarters and contributed to Social Security or has received Social Security disability insurance for more than 24 months, people with myotrophic lateral sclerosis or ALS, people with end-stage renal disease. Now let's talk about what each section of Medicare covers. Medicare Part A covers inpatient hospital services, short-term stays in hospice care, nursing homes, and home health care. Next, Medicare Part B covers outpatient hospital services, physician visits, labs, medical equipment, and diagnostic tests such as x-rays and MRIs. It also covers a very limited number of outpatient prescription drugs. Knowing this, there are a number of items that are not covered under Medicare Part A and B, such as dental care, hearing aids, eye care, and various types of vaccines. Now let's skip Medicare Part C and talk about Medicare Part D. Medicare Part D is a voluntary outpatient prescription drug benefit for those with Medicare and provided through private plans pre-approved by the government. It covers generic and brand name prescription drugs. And finally, Medicare Part C is sometimes called the Medicare Advantage program. It is designed as an all-in-one package that combines Part A, B, and D, which includes extra benefits and lower cost sharing requirements than traditional Medicare, such as vision, hearing, prescription drugs, routine physical exams, and dental.
Here I have a chart of the enrollment periods for Medicare. The initial enrollment period begins 3 months before your 65th birthday and ends 3 months after your birthday. The open enrollment period is from October 15th to December 7th each year, where you can join, switch, or drop a plan. If you miss the initial enrollment period, you can also enroll in Medicare during this time. The Medicare Advantage open enrollment period is from January 1st to March 31st each year. During this period, you can change or drop your Medicare Advantage plan, but you cannot sign up for a Medicare Advantage plan if you only have original Medicare. Some people get Medicare Part A and B automatically, and some people have to sign up for it. You are automatically enrolled in Part A and B if you already receive Social Security benefits or disability benefits. Generally, if you need to sign up for Medicare, you should enroll in Medicare Part A and B when you're first eligible during the initial enrollment period. You can choose to delay or opt out of Part B coverage since you're required to pay a monthly premium. However, if you delay Part B coverage and enroll at a later time, you will have to pay a late enrollment penalty fee. Original Medicare plan only includes Part A and Part B. Medicare Part C and D are run by private insurance companies, and you must enroll in these plans separately. These include Medigap, a Medicare supplement insurance, Medicare Advantage plan, which is the all-in-one coverage plan, and Medicare Part D, the prescription drug plan.
To apply for Medicare, some preliminary information is required. This includes your social security number, birth date, and place of birth, as well as your citizenship status. If you were born outside the United States, you will be required to show documentation that proves your age as well as your U.S. citizenship or legal residency. Some examples that can prove or show proof of your age and U.S. citizenship are a U.S. passport, naturalization certificate, or certificate of citizenship. For non-US citizens, you'll need to show your green card or permanent resident card number. Note that this is the minimum documentation needed for Medicare. If you were to apply for spouse or retirement benefits, additional documentation is needed, including information regarding children, military service, marriage status, and employment. Once you have all of this information, though, you are able to apply online through the Social Security website and fill out the application for Medicare.
Now that you've talked about Medicare, let's talk about Medicaid. So what is Medicaid? Medicaid is a joint federal and state program that was created in 1965. It is the largest source of health coverage in the United States. 2018, 97 million people were covered by Medicaid. Federal Medicaid covers low-income families, qualified pregnant women and children, and individuals receiving supplement security income. States can choose to expand Medicaid coverage to more individual groups that are struggling financially if they see fit. The Affordable Care Act in 2010 increased coverage to low-income families under 65 and adults and children near the federal poverty level.
In summary, the difference between Medicaid and Medicare is that Medicare is managed by the federal government and is mainly based on age, which is above 65. But there are special circumstances, like certain disabilities, that may allow younger people to get Medicare as well. Medicaid is managed by states and federal program, and it is based on income, offers benefits not normally covered by Medicare, like nursing home care and personal care services. One can be eligible for both Medicare and Medicaid. Some people qualify for Medicare because of their age or due to having a disability. They are also eligible for Medicaid because they meet the requirements to qualify for Medicaid in their state. These people are considered dual eligible. Dual health plans are designed just for people who have both Medicaid and Medicare. They are a special type of Medicare Part C, also known as Medicare Advantage Plan. Dual health plans combine hospital, medical, and prescription drug coverage. You will keep all your Medicaid benefits, plus you could get more benefits than with original Medicare. And you could get it all for a $0 plan premium.
In order to apply for Medicaid, the individual must meet the residency requirements, meaning you have to be either the citizen of the United States or a qualified non-citizen, like a green card holder, and has to be a resident of the state that you're applying for Medicaid. The individual of all ages applying for Medicaid must meet the income limit, which varies between states, typically around $2,200 a month, and depending on your age, disability, marital status, and family size. It is determined based on the modified adjusted gross income. Your assets, including your bank accounts and investment, will also be accounted in determining your eligibility. However, there are exemptions to the income eligibility, specifically if you're over the age of 65 or visually impaired or have a disability. There might be other specific requirements that you need to check depending on your state law. It is advised that you should double check before applying for Medicaid.
To apply for Medicaid, you can take 3 steps. Step 1 is to see if you're eligible for Medicaid in your state. Since the Medicaid program and application process differ from state to state, you can go to healthcare.gov website, or you can call your state Medicaid offices to make sure if you're eligible for Medicaid in your state. Step 2 is to gather all necessary information to fill out a Medicaid application. The documents required including proof of date of birth, like a birth certificate, proof of U.S. citizenship or lawful residence, such as passport, driver's license, birth certificate, green card, or neutralization certificate. Proof of all type of income, earned and unearned, including paycheck stubs, retirement benefits, supplemental security income. Proof of resources, such as bank or stock statements, life insurance policies, and properties. Proof of residence, such as rent receipt, landlord statement, and deed. And also the Medicare card and any other insurance cards. You can also provide a copy of the insurance policy. And after you get all the documents ready, you can take the 3rd step, which is submit your Medicaid application. Thank you for watching.
Hello everyone! We would like to thank you for your time watching this video. My name is Chi Lee and I'm currently a P3 and the Vice President of Asian Pharmacists Association. I'm the person in charge of overseeing the Special Projects Committee and the video editing. Please feel free to contact us if you have any suggestions or improvements. Once again, please subscribe our channel and stay tuned for more videos.